The South African Medical Technology Industry Association has condemned inappropriate and unethical business practices relating to medical technology. The associations responded to allegations of unlawful procurement of personal protective equipment, sanitizers, and other items essential to the COVID-19 response. For more on this, we're joined by Summit Executive Officer Tanya Vogt. Tanya, very good afternoon to you, and thank you very much for your time. So you've, of course, condemning this unethical business practice, but where are you finding it to be happening exactly?
So good afternoon, Maremi, and thank you for the opportunity. Frankly, we are absolutely appalled and deeply concerned with these reports, and that these companies are tarnishing an industry that is essential to providing products that diagnose, that heal, that treat patients. So, we're taking this very seriously. In fact, a zero tolerance to corruption is at the heart and soul of SAMED, of who we are. And if any of our members are found to be implicated in this, we will use whatever means we have at our disposal, be they internal or external mechanisms, to get to the core of the matter. Thankfully, none of those companies that have been mentioned in the media are SAMED members. However, one of the criteria of belonging to SAMED is, in fact, that when you sign up as a member, you sign up to compliance to a code of ethical marketing and business practice. And we've had this code now for almost more than 10 years, and we take it very seriously. We provide training, ongoing training to our members. In fact, we even have an independently managed whistleblowing hotline that anyone, be it a patient, be it a procurement official, be it a doctor, can lodge a complaint against any of our members who they feel may have transgressed the code.
Tanya, you're saying that the companies that have been mentioned in the media space are not aligned with SAMED. Do you know if there's anything you can do to those companies that have been implicated? Perhaps, report them to authorities in any way? Is there anything that the association can do, to deal with the situation?
So you're absolutely right. We don't generally have any jurisdiction over non-members. However, we have in the past and still continue today, if anybody knows of something that appears to be an alleged corruption or bribery in our industry, you're more than welcome to send us an email. You're more than welcome to use the hotline, and we will take it up with the authorities, whether it's the police, whether it's the South African Health Products Regulatory Forum, whether it's the SIU.
What kind of corruption are we talking here? I mean, I know you're mentioning that there's bribery that is something that can take place, but what kind of that which you've been made aware, what kind of corruption exactly is happening where this medical technology is concerned?
So really, what we've heard has been in the media. We haven't personally had any direct reports made to us. However, corruption takes many forms. It could be a bribe, it could be a gift. And so in our code, for example, we look at a number of areas where our members would engage with, for example, healthcare professionals, whether it's actually in the workplace, the kind of training that they provide to the users of medical technology, even counterfeit products, supplying counterfeit products, price hiking. These are all forms of corruption, and they need to be stamped out.
Tanya, there's obviously been the matter of the tender scandal, the PPE tender scandal involving the MEC of Health, Bandile Masuku, and the president's spokesperson, Kusela Digo. I mean, just to get your reaction on, something that of this nature that is coming out now, and of course, clearly happening at very high levels. What is your take on this kind of PPE scandal?
Well, I think it shows that there are huge gaps in terms of how we're procuring. And even though there is legislation such as the Anti-Corruption Act, such as the Preferential Procurement Management Act, unfortunately, it appears that there are loopholes. And I think one really needs to go and look carefully at the procurement processes, the systems, the transparency. I think we focus sometimes too much on price-based procurement. We need to rather look at value-based procurement. We need to look at outcomes. We need to make sure that we're doing business with credible companies, not fly-by-nights that have just been set up to make a quick buck, but really companies that have got quality management systems in place, that are registered with the relevant authorities, that have been around, that provide adequate support, training, service, after sales. And I think this is an opportunity for our government officials, for both public and private sector, to review how they procure medical technology. It's not like any other commodity. It's not like procuring toilet paper. You know, companies have to have proper regulatory systems in place to make sure that you're selling quality, cost-effective, and safe medical technologies.
Thank you very much, Tanya. She's Tanya Vogt, who is the Executive Officer of the South African Medical Technology Industry Association, highlighting the fact that the association is condemning inappropriate and unethical business practices relating to medical technology.